Hi everyone, I'm Dr. Wright, and today we're going to be talking about shockwave therapy. People think of shockwave as an electric shock, but that's not true. This unit especially uses an acoustic shockwave, and we're using it most often to treat soft tissue injuries in the body. A lot of ligaments, tendons, sprains, strains, and the way it works is that we send this high amplitude sound wave into the body, and that sound wave, it almost mimics trauma to the area. It disrupts the cells in a way that they begin to leak some of the proteins, and it causes an inflammatory response to that tissue, which then stimulates a healing environment in the body. So it's especially helpful for those chronic injuries that your body's kind of given up on healing. This machine it's a really good way to jumpstart that healing response in the body again. We'll typically do a trial with it, make sure that it's something that the patient tolerates, make sure that it's something that we think is going to be beneficial, and usually after that I'll make the recommendation as far as, number of treatments that I think it might take, which it can range from anything from 3 to 10. Usually it's somewhere in the middle. And then we'll set up a treatment plan and frequency. Typically, we start more frequently, maybe a couple of times a week, and then towards the end of that plan, we do a taper and make sure we're hitting the goals that we need to with that patient. Most of everybody is a good candidate for shockwave. The only exception of that is the younger audience. One of the big contraindications, and really the only contraindication to shockwave, is that you don't want to be doing it over open growth plates. So depending on the age of the patient, that 14, 15, 16 years old, you might be cutting it as far as, the age restriction. But if that is the case, usually I recommend an x-ray of the area. That way we can make an assessment of what the growth plate looks like and if it's fused completely. If so, we're good to go, and we're good to hit that area with the shockwave. If you think you're someone that would benefit from shockwave, give us a call. We'll get you in here, we'll do a full assessment, make sure we have a good diagnosis for what's going on with you, and then we'll put together a tailored package and plan that will help you to achieve the goals that you're looking for.